Are you looking to break away from your current job situation and be your own boss? Are you tired of someone else telling you what to do and how long to do it and when you can take a vacation? Or maybe you know that you have the ability to earn more than you're currently earning by working smarter, not harder, but you've just not found the right business, the perfect vehicle to reach a higher income level. Well, you're in the right place at the right time. Hello, my name is Patrick Phillips, and I'm the right person to hear and listen to for the next hour or so. I guarantee you. I've changed the lives of hundreds of people from every possible background and educational status. I've taken people from every walk of life and helped them fulfill their dream of becoming their own boss and owning their own life. So silence your cell phone, close up your email, turn off the TV, quit watching the videos on YouTube of cat videos, and put out the cat if you have one, and focus on what I have to tell you on this live webinar today. And maybe, just maybe, you'll discover how you can make your dream come true as well. Maybe you want to travel while you can still enjoy it. Maybe you want to retire earlier than you had planned. Maybe you want to put your children through college or help some of your loved ones financially. Or maybe you want to build that dream home by the lake and play more golf or spend more time with your kids and grandkids. Whatever it is that you're looking for, you can achieve it by being in control of your life and your destiny. Now listen to this secret. I found out a few years ago that 83% of all wealthy people in the United States, 83%, got wealthy with the one secret that I'm going to share with you on this webinar. Now, it has nothing to do with inheriting wealth. Most people don't have a rich uncle or aunt, and even if they do, they probably are not their favorite nephew or niece. And if you think you're lucky and will someday win the lottery, your chances of that happening are about as good as being struck by lightning in the same spot 7 times, okay? And unless you have the training and the education and the financial means to go and be a doctor or a lawyer or some other professional, your best bet to wealth is to do what that 83% did to build wealth that I read about. Are you ready? Here's what most wealthy people did to get wealthy. They started and owned their own business. Now, I've started dozens of businesses over the past 50 years, but the one business that helped me to make all my dreams come true, for me and my family at least, was the business that I'm going to tell you about today with the help of our guest, Dr. Vicki Rackner. Now, it's a very niche business that you've probably heard of, but maybe you never knew anyone personally that had made any money with it. Here's what you'll be doing. You'll be helping medical providers in your area to collect more of the revenue that they have earned when they were seeing patients. Now, here's what that entails. It's real simple. You'll be accessing a cloud-based award-winning software system that we have for you to submit the claims to insurance companies and the government agencies to help the doctors get paid more, and by the way, a lot quicker than they are able to collect using their own staff in their own office. You'll not only save the money by outsourcing their billing to you, but you'll collect a larger percentage, and you'll collect it faster than any other company that they might want to use anywhere in your area to help them with their cash flow. But more about how you can do that just a little bit later in the webinar. Today, with the help of our special guest, Dr. Vicki Rackner, we're going to pull back the curtain on this little known business. And we're going to tell you how you can get involved in it if you think it's right for you. Now, I'll tell you right off that this is not for everyone. Not everyone can follow directions. Not everyone can figure out how to market something like this to doctors. And not everyone even wants to be involved in the healthcare industry. But for those who followed my instructions and followed our system that we've developed over the last 25 years, these are the people that are entrepreneurs that have gone through our proven training program and they become certified medical revenue managers. That's a long term for medical billers. But they're much more than that. They've built businesses that can bring them all they want out of life. And I just hope that you're one of those people after you hear what I have to share with you today. Now, let me introduce myself, and then I'll introduce you to our guest, and we'll see if she can give you some insight into this business as we go through the webinar today. So again, with our cloud-based system, we're going to show you how to get your own business started. Again, my name is Patrick Phillips. I'm the founder and the CEO of the company, American Business Systems. But I'm also a published author. Here's some of the books that you can find out here on Amazon.com and in your local bookstore. But I'm also on the editorial board of a magazine. Yes, a printed, published magazine. They still print them. Yeah, can you believe it? That has over 40,000 subscribers and that is a respected magazine in this healthcare industry. It's called Billing and Coding Advantage Magazine. I'm also on the board of the Medical Revenue Management Association of America. And as I said earlier, a mentor to hundreds of entrepreneurs and would-be business owners from coast to coast. Now, my guest today is Dr. Vicki Rackner. She's a retired general surgeon and a professor and instructor at the Washington School of Medicine. She's the author of over a dozen books that you can find all over the internet. And she's well-known and respected lecturer and an expert who's been interviewed and had articles published in national magazines and television programs for the past 10 years. She's invited to speak at medical conventions all across America, and she's the medical marketing director of the Medical Revenue Management Association and founder of targetingdoctors.com. Dr. Rackner, welcome to our show today.
Well, thank you very much, Patrick. It's always a delight to talk about how people can achieve their dreams.
Well, thank you for taking time out to share with people on this. You know, a lot of people come to these webinars, they don't know what to expect, but I thought by interviewing a retired surgeon who's had all the experience that you've had in the medical field and relating that to what our business is all about, maybe they can relate to it. Here's your latest book, by the way, that she just had published called 10 Critical Questions for Physicians in Private Practice. And look at the subtitle, and the single choice that can help your practice to prosper and grow. You want to share a little bit about that, what that secret is?
The secret is outsourcing your billing. So what might be a surprise to those participating in the webinar today is that while doctors are very, very smart, they're not very smart about business and about money. So Patrick, you quote the statistic that doctors are walking away from about 30% of their revenue by not following up on rejected claims. And as you go out and speak with doctors, what you're going to discover is that there's this epidemic of despair. Doctors are very unhappy. Doctors want to make changes, and they overlook the obvious. If they are so unhappy in their private practice, you know, one of the things that they can do is figure out how to, as you point out, work smarter and not harder. And doesn't it make a whole lot of sense to, instead of thinking about how many more patients I can see a day, is how to get paid for the patients I really did see. So when I was actually just starting my practice, I went into practice with another surgeon in solo private practice. He was getting to retirement age. He wanted somebody to share call. And so he invited me in, and it was a delight to go in. His office manager had done the billing for him. And I hadn't been there too long when she tendered her resignation. And in retrospect, I think what happened is I started asking questions. Okay, how does this billing stuff work? And I suspect that she might have been helping herself to a little of the surgeon's money. But anyway, she left. And what are we going to do? Well, my partner's wife said, how hard can this be? Why don't I just take some time for my tennis game and just do your billing? And we hired a temp as a receptionist, and things just kind of fell apart. Well, the temp was good. We thought she was really good. She would go out into the waiting room and help the little old ladies complete their paperwork. After not too long, the wife decided this was beyond what she could do and encouraged us to hire a professional. And we hired somebody. A couple months after the temp left, we got a call from the temp agency, said, we're really sorry to tell you this, but you know that temp we sent to you? Well, she actually is a Medicare felon. So the time she was out in the waiting room helping those little old ladies potentially was time that she was stealing their identities.
Oh my gosh, wow.
And so the temp agency said to us, hey, listen, if you notice any irregularities in your billing, this might be part of the picture. But the truth is that there were so many irregularities that who would even know? I mean, that quarter, we actually had to make an owner investment to pay our quarterly taxes. So it was a mess. And I saw how that financial mess impacted me. I mean, I borrowed money to go to medical school. I was supposed to be taking money out of the practice, not putting money in. And I don't know if you've ever been worried about money, but when that's a concern, it's sort of all you think about. So
Sure.
when I went out and decided I was going to break out on my own, the first thing I knew with absolute certainty was that I was going to outsource my billing. I wanted to feel confident that there was money coming in and that if something happened to my office manager, this was going to be taken care of. And in retrospect, all of my practice success was built around that one choice. And that's really what this book is about. How it did more than just make sure that my cash continued to flow, but it really helped me build my practice in a strategic way.
Yeah, and of course, we've talked about this on other webinars, but Dr. Vicki has written this book. But folks, this is actually a marketing tool for you. If you become a licensee and go through our training, you'll see that you actually can buy these books with your name and a picture and whatever else you want right on the back cover, right underneath Dr. Vicki's blurb there on the book. So it's like a business card, but it has some valuable content for those doctors. This is called educational marketing, isn't it, Dr. Vicki?
It sure is. And so, I mean, if you want to launch a business, probably writing your own book is the best expert positioning. I mean, think about how they describe an expert. Oh, he wrote the book on that. So this is the ultimate. And remember, doctors don't want to work with a vendor. They want to work with the expert. And so this does a great job of positioning you as an expert. But the other thing, and this is key, the most influential person in a doctor's life is another doctor. So I help people build their businesses by acquiring doctor clients, right? So I was working with one of my coaching clients and he said, we were going to do that seminar, but let's back off. I have so many new doctor clients. I don't think I could deal with another new one. And he had achieved what I call escape velocity. So what's happened is now everyone among circles of doctors knows who he is, and anyone new into the circle gets referred to him. You got to go see him. He is the guy. How did I find my outsourced biller? I asked my buddies, hey, are you outsourcing your billing? What do you think of this person? And when the same name kept on coming up again and again among people I really respected, I knew I'd found my person even before I met her. So the upside to this business is that once you become known among groups of doctors, the doctors are going to be like your auxiliary sales force. They will talk about you and they will help you build your business. So how do you get those first couple clients to work with you? Well, that's where ABS and all of the resources come in.
Well, look, I saw a quote from you in one of your books. I forget which one it was. There's so many out there, but this is what it says: the physician's pain is your opportunity. Can you explain what you mean to the people on the webinar today?
Right. So, as I said, even though doctors are smart and have the reputation for being rich, most doctors are in financial pain right now. Only half of doctors are prepared for retirement. They are overwhelmed with the new administrative burdens and the paperwork. They say, you know, I didn't go to medical school to treat the paperwork. I went to medical school to treat patients. And more their attention is drawn away from that. So doctors have a lot of financial pain. And let's say we're dealing with a doctor who walks away from 30% of their revenue. Maybe they're having a hard time meeting their payroll. Maybe their husband or wife is giving them some pressure to really get things going. And there are doctors who are committing suicide. On average, we lose an entire medical school class to suicide every year.
Oh my goodness. Wow.
Doctors are wondering, like, how do I just hang up the white coat? I belong to a Facebook doctor group. There's 40,000 doctors who are interested in how do you launch side gigs. Okay, why are they asking these questions? It's because they're not being smart about their business. And so you really have a chance of turning things around. And what do doctors really want? They want to be able to focus on patient care. And so if they're not worried about where is my money coming from, am I going to be able to meet payroll? Am I going to be able to pay off my medical school loans? Then that gives them more time and attention to really focus on what they love. Okay, just a number, if the suicide number wasn't astounding enough, there was a survey of physicians this past year, and 40% of the physicians who answered said that they experienced burnout this year, toxic stress, physicians ready to hang up the white coat. And I can tell you that with my experience with the ABS licensees, they go in and they can completely turn around a doctor's life. So a doctor could be in despair, maybe considering suicide, maybe considering just walking away from the practice. They can completely turn things around. So now that doctor is excited to get to the practice in the morning, is excited to be making these contributions. So ABS licensees really do make a huge impact. This is the right time. You've got a lot of doctors in pain, and somebody in pain is looking for solutions.
That's right. That's why we go to the doctor. We've got pain, and they have the remedy, hopefully, for us. You mentioned this book earlier, the fact that doctors, went to school and, of course, were told that they were going to be rich and make lots and lots of money. That used to be true, that doctors in general practice, at least, made a ton of money, but that's been reduced a whole lot, hasn't it, with all the different changes in the healthcare industry lately?
It sure has been. So I already mentioned that a lot of physicians are behind in retirement planning, but there's a lot of physicians, right, who are wondering, how are they going to pay for their kids' college education? Or how am I going to make my mortgage next month? And I've had conversations with hundreds and hundreds of doctors really getting their true, authentic money story. And what I conclude is that physicians just have a dysfunctional relationship with money. And I know that this is hard to believe, but to understand why that might be so, let's just assume that everyone wants to be successful, because everybody does.
Yeah.
All right, if you're a business person, the metric for success is your profitability, what's in your bank account. But for doctors, we have this ethic that the care a patient gets should be separate from a patient's ability to pay. So in our culture, we don't talk about money. Now, if you were at, let's say, an investor meeting, and the CEO of a company comes in and says, hey, we had a great year, profits are up 30%, bravo, everyone's going to be so excited. But could you ever imagine like a surgeon walking into the surgeon's lounge or the doctor's dining room and saying, I had such a great year, my profits are up 30%? That guy would probably lose hospital privileges, because that is just not how doctors think and talk. And if there's this cultural prohibition to talk about something, if it's sort of secret, if it's kind of scandalous, well, you're not going to take very good care of it. So the way I see it is everyone's got a relationship with money. Ever since we were children, we've been taught how to deal with money, and doctors just don't do it very well. And so I just wanted to tell the truth in this book, and this is the book that's gotten me invitations to speak all around the country, because everyone inside of healthcare kind of knows this, but I'm the first one who's sort of publicly talking about it.
Yeah, and I think that gets the attention of even the people on the webinar today, because folks are hearing from a doctor, her own experience she shared with you as to how outsourcing was important to her. To attend somebody who's an authority in the field that can also share this with other people. I think in this book and several others that you've written for us, Dr. Vicki, you've actually mentioned that that doctors can increase their revenue by outsourcing their billing. And I have a quote here, in fact, from Medical Economics that says that it was, if you operate a medical practice, you should be outsourcing. almost 80% of survey participants felt positive about their respective outsourcing relationships. Folks, that means they're outsourcing their billing to somebody outside their office, like yourself. Once you're trained in our training program, you'll know how to handle all that, of course. In other webinars, we go into that in more detail. Then it says, when it comes to outsourcing for your medical practice, it not only frees up your employees' time to work on the tasks that they were hired for, but it also unkinks your cash flow. Dr. Vicki, you'd agree, right? As a business person too, now cash flow is king, isn't it?
Cash flow is king, and I can tell you, as a physician who needed to make an owner investment, this is really important.
Yeah, because of course a doctor can focus with their own staff, their own software, their own IT department, their own computers, their own software. They could focus on doing the billing, but they weren't trained for that kind of thing, were they?
They weren't. And, I hired staff myself, right? So I couldn't run my practice alone. And what did I hire people for? I wanted people who were friendly, who the patients would like, who would be attentive to the patient's needs. And I didn't want to worry about how good are they at billing. I mean, it's a different skill set. I would rather just find somebody else who did that job. With TurboTax and all sorts of resources, I could do my own taxes. But it's so important, the impact is so profound that I want to go to the expert. And that's kind of how I thought about my about my billing, especially after my early experiences.
Yeah, what you went through is just hard to believe that you had two people that were, you think, dipping into the source of revenue there for the doctor. That takes some real, guts to try that. I would be afraid that I'd get caught. And of course, people are caught all the time and go to jail for doing that kind of thing, don't they?
Yeah, and by the way, medical practices are the target of theft and fraud. And so when I talk to other doctors, we're always talking about how to put checks and balances in place to keep honest people honest. I had a buddy, I was a breast surgeon, and I hadn't seen my buddy in a really long time. So I asked people, hey, what's with Diane? And they said, you haven't heard? Her assistant embezzled her entire retirement, and it's gone. And now Diane went into a deep depression. So that's why you don't see her around. But this is a constant worry about doctors. I contribute to a publication called the Journal of Medical Practice Management. And the owner of the publication told me that in every issue, they've got to have something about theft and fraud, because this is something that's really top of mind with doctors. And, I believe in system solutions. So outsourcing puts in checks and balances.
Yeah. The Doctor Patient Medical Association Foundation said 2 out of 3 doctors say that they're just squeaking by or in the red financially. Now, that's a good reason to want to reach out to the doctors in your area and help them with their cash flow, because if they're struggling, then they'll either shut down their practice or go to work for some big group or hospital. We need physicians in private practice, don't we?
That's true. And here's the other thing. Doctors are kind of embarrassed about this, right? Because we know so much about so many things. It seems like taking care of money should be really basic. So you're not going to be able to tell who's in what situation. The doctor who is struggling might be driving a Mercedes, live in a luxury home, take luxury vacations, and they could be one mortgage payment away from foreclosure. On the other hand, the doctor who's driving the 10-year-old beater probably has millions in savings. So you don't know who is who when you just meet a doctor or look at what's going on in the doctor's parking lot.
Yeah. Well, that's true of some of your neighbors. They could all be filing bankruptcy tomorrow, even though they're living in a nice home and driving a nice car. You just don't know what's going on behind the scenes. Now, here's a question from Anna. She's actually asking a question here that I'm going to get to in just a little bit more in detail. But one of the questions she's asking is about, is it easier for doctors to do this themselves? Why would they not do it all in-house? So I just happen to have a slide here that I'm going to get to. Here we go. That actually talks about this in detail. Now, let me show you some of the things this is the difference, folks, between outsourcing in-house. Oops, I'm sorry, I'm moving the chart around. I meant to grab my little highlighter thing here. Let's see if that's working here. Yeah, there we go. Oh, no, that's not going to work. I don't know what I'm doing. Well, anyway, I'll just point to it here, okay? So you can see doing it in-house, the doctor could hire their own people to do it. Of course, they'd be paying somebody, let's say $15 an hour, 1.5 people to do this kind of 20 claims a day is what this is. Payroll taxes and workers' comp and errors and omission insurance and training costs and leave coverage, and temporary benefits and so forth, hardware, software, IT support, all of that adds up. Look, it could be $65,000 a year the doctor's spending just to do the billing in their office. Whereas if they outsourced it to you and you're charging even say 6% to collect those claims, you'd just be charging them $31,000. So look at the difference there, folks. It's 48% less expensive to outsource. Now, you probably kind of experienced that, didn't you, Dr. Vicki? Because you had at one time tried to do it in-house and then you outsourced it. It's very expensive. Hidden costs in there, aren't there?
Well, I think that the real cost that's not reflected in here is the cost about worrying about it and not collecting this revenue. Now, let me say again, I had to make an owner investment in my practice. Wow. That is expensive. I mean, I was buying peace of mind and in the end, more money in my checking account. And that's what I want. At the end of the day, I wanted more money in the checking account. Yeah. And I knew that outsourcing my billing was going to help me get there.
Yeah, and there's been research done by, this is a company called the Black Book Research Organization. And as you can see, this is the managing partner of that company. He says rising healthcare expenditures and the complex technology or staffing requirements creates an urgent demand for cost-effective outsourcing solutions in physician practices across the country. Doctors outsource more than just their billing, don't they? Like you said, they don't do their own taxes, for example.
Right. I didn't read my own x-rays. My mentality is to go to the experts because the experts know what's going on. So let me just sort of pull out some more information from this 10 reasons that I'm glad I outsourced my billing. One of the things that doctors get really worried about is audits. And who gets audited? Well, the outliers. They're actually kind of like bounty hunters that go out and look for people who engage in Medicare fraud. And the people who find these doctors actually get a percentage of the repayment. Okay, so every doctor is really, really worried about this because if you're audited, well, if the IRS audited you, you wouldn't be real happy. And this is even worse because you're assumed guilty and it's really hard to prove yourself innocent. Okay, so how do you know that you're an outlier? If you're just doing your own billing, you don't know what the standard is. But somebody who does outsourced medical billing knows what's going on in the community. It protects you so that you're much, much less likely to be seen as an outlier. And so you're not an audit trigger. Now, there are some doctors who just randomly get chosen to be audited because they're assumed to have reasonable billing practices and they want data points. But I wanted to do everything I could to make sure that I was going to be safe.
They're just protecting themselves. By the way, folks, one of the things you can do as an ABS licensee starting your own business is provide that service to doctors where you go in and actually pre-audit them so that they're protected when they actually are audited by Medicare with services that have to do with, it's called Audit Guard, and it just protects against that. Then there's the whole thing about HIPAA. HIPAA's getting, there's a lot of violations on HIPAA, aren't there?
Oh yeah, HIPAA. So every time you go to the doctor, you've got to sign a form. It's called a HIPAA form. And what it is a statement of the doctor's privacy policy. So how they're going to maintain your medical information privately. Now, this is something people take like really seriously. And there are all sorts of rules around what the duty of doctors and hospitals and medical organizations are. And being in violation of these rules can be very expensive. So I know somebody who had an office manager. She took her laptop on vacation. It was stolen, which is always a bummer. But what was more of a bummer is that she had medical records on that laptop that were not protected. And it was a $250,000 fine per record. Ouch.
Per record. Wow.
Per record. So this is something that doctors are really worried about. Most practices, if they were audited from HIPAA, they would come away with serious fines. And I think a lot of practices feel like they're vulnerable. And Patrick, I think you were mentioning that your ABS licensees can sort of go in and get past, what do you call it, getting past the glass door?
Past the glass. Yeah. That magical, that bulletproof glass that's there in front, separating you from the doctor.
So one of the ways that you can actually get past the glass, and ABS is really good about giving you actual strategies and tactics for doing it, is offering offices a complimentary audit just to check on some big items that are associated with HIPAA compliance.
Yes, that audit, by the way, is something that you can do at no cost to you or to the doctor, and you can give them enough information to make them feel like, wow, I really do need to check more into this. And you have a service that you can offer through us, through our partners, that is basically a protection against the government coming down and fining the doctor for all those HIPAA violations, because it keeps the doctor and their staff up on all the changes with HIPAA and the rules and regulations that are involved there. It's a pretty complicated thing, isn't it?
It is.
Okay, so let's see, what time is it here? Oh gosh, we're about halfway through. I just wanted to show this one slide here because, folks, our system that we're talking about, by the way, is a practice management system. That is, you can actually do the billing through the cloud-based system, but we also have electronic medical records. Dr. Vicki, talk to us about how that's changed the whole medical landscape.
Well, let me first answer from a personal point of view. So my mom was in the ICU, and I went to see her, and the nurse was dealing with the electronic medical record that faced away from my mother's bed. So like literally the electronic medical record got in the way of her relationship with the patient, my mother. So from a medical point of view, we doctors hate it. We have to use it, but we hate it. And remember how I told you that a lot of doctors are burned out? When they were asked why, electronic medical records was, in one of the top 5. Doctors hate this.
Yeah, I can see why, because it is, first of all, it's a complete technological change inside the doctor's office. They're going electronic, which means they've got to learn the system itself, and then they've got to figure out how to use it. I was just visiting my own doctor about 2 weeks ago, Dr. Vicki, and he walked in for the first time with a laptop. And I go, oh, hey, you're getting very high tech here. And he immediately turned and set the laptop on the table behind him and did not face me as he filled out all this stuff for electronic medical record. It was very impersonal. And that's what they hate about it, of course. Now, with our system, of course, the doctor can actually use that on an iPad, as you see there in the bottom left-hand corner there. They can actually carry that iPad in and hold it right in front of them. So you can look over that to the patient, but you can still put in what you need to make sure that you're going along with all the rules and regulations about electronic medical records. It's a great system. It's cloud-based, so you can literally look at it from anywhere. The doctors love it once they see it. And folks, by the way, we can give you a demonstration of this system anytime you want to. We have people here at our office that can actually do a live demo one-on-one with you and actually ask, just ask the person that sent you the email to this this webinar. If you don't know who that is, I'm going to give you our phone number here towards the end, and you can call in. Now, let's see. I have a question coming in here, several of them. I'm going to get to them as I can here. Jessica says, do the coders in the office do the billing as well, or are these separate roles for separate people? Usually a coder is not the person who does the billing inside of a doctor's office, at least. Is that right?
It's variable. So I actually was the one who would decide on the codes, right? So I came up with a diagnosis code and a procedure code, and and these things are complicated. They're changing all the time, and the amount of money that I would get paid was totally dependent on this code and the insurance carrier. So just to give you an example, and this is maybe 30 years ago, if I did an appendectomy, I could get paid anywhere from $200 to $2,000. And so you want somebody who really knows these codes
Sure.
and finds the right codes. And then you need somebody to actually submit the claim to the insurance company and follow up if and when it's rejected. So if somebody is outsourcing their billing, probably what's happening is that a doctor is doing a first sort of go through with the code.
Right.
And then the biller, the ABS licensee, will go through and say, now, doctor, do you mean this code or this code? Because you're going to get paid $400 more for that code.
Yeah. Well, that's exactly what our system does. All the codes, and there's thousands of them, by the way, procedure codes and diagnostic codes, they're all built into our system. So folks, you don't have to be a coder. You don't have to hire a coder. What you need to do is become familiar with our system, because as the doctor gives you those codes, like Dr. Vicki just said, the system then checks and shows you exactly what that code is supposed to be, and gives you the alternatives that you could go back to the doctor and suggest. Now, they got to be careful, don't they, Dr. Vicki? Because the doctor can get fined for over coding as well, right?
Absolutely. And what I wanted was I wanted to be fair to the insurance companies, but I wanted to be fair to myself too. And there's
Sure.
a whole lot of doctors who are not being fair to themselves, usually because of the fear of audits.
Yeah, the fear of an audit. That's right. Because if the Medicare came in and said, "Oh gosh, you've been over coding for all these things," they get fined for each one of those, don't they? Some huge $10,000 or something like that. We see that all the time from our licensees. So doctors don't realize how dangerous it is to do their own coding without somebody checking and making sure that that code is correct.
Right. And again, let me state that who gets targeted for an audit, it's the outliers. And if you're only looking at your practice, you don't know where you stand in the bell curve.
Yes, that's right. And we have services, again, folks, that are provided by certified medical coders to you for your doctors. So you don't have to be the coder. We just engage with those trained coders to actually help you out with that stuff. And of course, you're charging the doctor for that as well. So all of that is something that you do for a fee. Okay, so the rest of Jessica's question was, as a licensee, would the claims be coded by the staff in the office prior to me receiving them? Yes, that's generally what happens. But our system will check when you put that number in there, that code, it'll check and make sure that there's not some other codes that could be used. And then, of course, it's up to the doctor to make those decisions. You don't want to make any of those decisions because it's not your business, it's not your practice. Okay, well, let's see. I have lots of other questions coming in here. I'm going to get to them as I go along. But first, I wanted to show this. This is something that you brought up one time, Dr. Vicki, and that was that the doctors all have some sort of financial pain. So you want to talk a little bit about the different types of pains that they have?
All right. So, boy, I've been through all of these, Patrick. Okay, staff retention. Oh, man. So I would find somebody that I loved, train them up, and then inevitably something would happen. Oh, my husband got transferred. I had one of my office managers have a clinical depression. She wound up staying with us for a while. So what if you lose your biller? Hey, I've been through that. Bad things happen. So, I mean, outsourcing the billing really helped disconnect my cash flow from any personnel issues that I was dealing with. We've already talked about burnout, about this epidemic of despair. When doctors were asked, what do you need to turn this around? One of the answers was more money. And, imagine running a business and just, leaving 30% of your revenue on the table. Oh, 70, go ahead and pay 70% of my bill. That's fine. Well, doctors who are doing that on a daily basis are burned out. And if you want to get more money, doesn't it make sense to just get what you're actually owed? Doctors are worried about payer audits. They're really worried about liability, theft, and fraud, like we were talking about. And, part of their pain is this administrative person, that they're treating the charts and not the patients. So anything that can help a doctor get disconnected from these business-like issues means that they have more time and more energy to focus on the things that they really love, which is taking care of patients.
Yeah, that's what they really were trained to do, wasn't it? To take care of patients and deal with medical. They don't really want to do this kind of stuff, but some of them don't know that it's better to outsource. They think it's cheaper or they want more control over it. The great thing about our system, folks, is you can give the doctor access to it, see the status of their claims and their money at any time. I mean, they could be literally on vacation. As long as they have an internet connection, they can see it.
Yeah, and this really is the myth of control. Like, how are you in more control? Are you more control when you have things in-house, or if you set up a system? So, all of our human behavior is designed to achieve a certain emotional state, and there's 4 basic states. You want to be in control, you want to be connected to others, you want to be right, or you want to be admired. And the driving force for most doctors is being in control. And they have this idea that if I control my staff, then I'm more in control of my cash flow. But we've already talked about a number of reasons that is just a fallacy. That doctors are more in control when they've got a system of checks and balances. They're in more control when the tasks are in the hands of the experts, the people who are specifically trained and skilled in doing this.
Yeah, it just makes sense. The same way you said you'd outsource your taxes, for example, you wouldn't probably even keep your own books. Most people outsource that to a CPA to make sure that it's done correctly and according to all the tax rules. The doctor doesn't want their own windows. They're inside of a medical practice because it just makes sense. The window washer is the expert in how to make those windows clean. The doctor's not, the staff is not. And so that's why billing needs to be outsourced. And Dr. Vicki, I don't know about you, but I have found through our licensees from coast to coast that we have literally hundreds of doctors who've reported, 2 of them, and some of them say that they do it in-house. It's still about half and half. So it doesn't matter because a lot of the doctors that our licensees are signing up are the ones that have already outsourced it. They're just not happy with that outsourcing company.
Right. Now, as I understand, Patrick, there are all sorts of business models. I mean, obviously, it's most profitable to do all of the billing for doctors, but could a licensee generate revenue just by doing like the HIPAA part, selling HIPAA services, or
Yes.
maybe problem cases? Do you have any tricky cases that you're having a hard time getting resolved? Come to me. I can help you do that.
Yes, we refer to all of our ancillary services. There's about 7 different services that we offer to licensees that they can offer to the doctors, all based on cash flow and the revenue of the practice. But we refer to those as door openers because sometimes they think their billing is in their control. It may not be, but they think it is. And so there's no need to, they don't want to talk about that. But boy, you walk in and say, can I speak with your HIPAA compliancy officer? They get excited because they know they should have one, but they don't.
Yeah. There's something else I want to point out, and that is that, okay, let's say a doctor decides to keep the billing in-house, right? So he's hired somebody to do the billing. This employee wants to be well respected, wants to be perceived as doing a good job. So do you think that this person is going to have a real strong incentive for collecting every penny when they have no financial skin in the game? If there's an issue with collections, do you think that they're going to voluntarily go to the doctor and say, hey, look, doctor, we're not collecting as much as I think we should be. Let's
Right.
start thinking about, no, because an employee who goes to the doctor with those kinds of issues, is not going to be seen in the same way. With outsourced billing, and this is part of what I like just about the general idea, I want my biller to have financial incentive to collect every dime. And I was happy to pay. We were both on the same page. We both wanted the same thing.
Yeah, Gina is asking a question here about that. She says, how do you charge for the billing to the doctor? And of course, that's usually on a percentage basis, isn't it?
Oh, well, you're the expert. You can tell them how
Hey,
licensees charge. I've told you similar stories, but doctors are vulnerable. Oh, but there's
here
a
she
new
is.
guest here.
This is Olivia, my granddaughter. She's 18 years old, right?
No.
You're about half that. And I also have my grandson here, my latest addition to the family. Yeah, this is Daniel. You're only 6 months old, aren't you?
7 months here in a day or two.
7 months. Wow. Yeah. So anyway, I just wanted to show my family. Thank you, darling.
Thank you.
Love you.
Thank you very much, Patrick.
Yeah, you bet. See y'all later. Bye-bye.
See you.
They were waving at me and I thought, well, this is a good time to show people I'm a real person. Folks, this is why I do this. At 70 years old, I'm just as involved in this business as I have been when I was, 30 years old. So the reason for that is because I'm changing people's lives. There's nothing more exciting than this. I don't believe in retirement, and neither do you. I know that.
Absolutely. And, I can speak for myself. Family comes first. That's the most important thing that I can do. When I was a practicing surgeon, my patients had to come first. But the beauty of being an entrepreneur is that you get to decide what's most important to you, and your calendar can reflect your values.
Yeah, that's right. Oh, so I was asking this question here from Gina about it's on a percentage basis, and I don't know what you said about that, but generally our licensees charge anywhere from, I don't know, 6 to 8%. That's generally what's accepted out there. And like you said, Dr. Vicki, that's an incentive for the doctor to outsource, because if that person gets, say, 6% or 7% of everything that's collected, they've got some motivation there. Whereas the staff person probably gets the same pay no matter what,
Right. And the staff is usually pretty resentful because they work hard too, and they see the disparity between a doctor's income and theirs. And that's probably something that should be addressed. It's not a good system.
I mean, that's just human. I would feel the same way. Look, yes, I could work a little bit harder to collect a little bit more, but the doctor's driving a pretty nice car compared to mine, so I don't have any incentive to go after that money. Whereas you, as a licensee, folks, you would be the one who's going to earn money for every dollar you collect. You get, 6 or 7% of that. It mounts up.
It does. And let's just talk some real numbers. You can go online and find compensation surveys. So I'm not telling you anything that you don't have access to. If you look at the average fellowship trained orthopedic surgeon, their starting salary is about $500,000. So this is $500,000 that they're bringing home after they pay all their expenses. So they're probably collecting $700,000, $800,000, $900,000 a year. Well,
Yeah.
I'm sure you wouldn't mind having, 3 or 4% of $800,000 a year, and that's just for a single doctor.
Yeah, that's right. In fact, we have a calculator on our website that you will see at the bottom of most screens. Let me put it back up here and you'll see it right up beneath this book here, absystems.com. There's a calculator on there that will actually let you plug in your own numbers, and you can see the approximate amount of money that you can make for doing the billing. I think for one doctor, it averages about $25,000 or $30,000. Average doctor, average general practice doctor. All right, Rashim says, this is a great question. What is the risk factor as far as the legal liability of a medical billing business owner? If they're doing what the doctor tells them to do, there's not a whole lot of risk there, is it? It's only if they're kind of trying to defraud the doctor or the government, I guess, that they'd be in trouble.
That is a really interesting question. Like, what if the doctor were sued? Would the person who actually did it be on the hook? I would imagine that if the person doing the billing knew that there was fraudulent activity and participated, then they should definitely be busted. But if somebody is just sending in the numbers that the doctor gave them, I don't imagine that there would be liability. Patrick, you've been in this for years and years. Have you ever heard of licensees?
In 25 years, we've never had anybody have any kind of problems like that. But there is an insurance out there that people in this kind of business can get. It's called errors and omissions insurance. It's very inexpensive, and it can cover you for, no matter what happens. So some people are more prone to buying insurance than others. There's some people who they have insurance. If somebody falls in front of your house on a second Thursday of the month and they break their left leg, that they have insurance for that.
That's me.
That's you. Yeah. So, okay, let's see. Jessica says, is it hard to convince a physician to switch over once they've been doing in-house for years?
Okay.
Just depends, I guess.
Is it hard to get patients to take medication? The answer is yes. If they're having pain, they're more likely to have the medication. But part of the art of marketing to doctors and engaging them and inspiring them to take good action is helping them identify what's really important to them and how they're going to get there. I mean, doctors are going to be willing to talk to you because they have pain. Something is not going on. And if you can have a conversation and get a picture of what a doctor really wants and shows how you can help them get there, you can paint that picture and then compare the other picture to what happens if a doctor is on the current course. So the reality is that the only person who can control a doctor's behavior is the doctor. You have all of the tools that can give doctors the opportunity to buy, right? To make the choice that's going to help them get the life that they want and, get out of the pain that they're in.
Yeah. Folks, I didn't make a big deal of this, but we've actually partnered with Dr. Vicki. She's a partner with us, helping licensees like yourself to build their business. But she's also written books that help you market. I mentioned one earlier. Here's another one, The New Thriving Medical Practice. She and I wrote this one together. And the reason I bring this one up is because this one you can actually have personalized. Look, I'm going to zoom in so you can see the bottom of this. See down here, it says forward by Susan Smith, CMRM. That's a certified medical revenue manager. That's how you get certified through us. And that can be your name right there on the cover. In fact, it's on the inside title page. Your name is there. You have your contact information here at the end of the forward. And Dr. Vicki, this adds huge credibility to people, doesn't it? To have their name on the front cover of a book with a doctor.
Yeah, so as you think about your business, like who is your competition? Well, it's really what doctors are doing right now. You want to inspire doctors to make a change. But if you look at other options for outsourced billing, I mean, there is nobody out there who basically has a doctor standing behind them. And remember, the most influential person in a doctor's life is another doctor. So a tool like this puts you in a class of your own. If a doctor is, trying to decide between you and another outsourced biller, you're going to win hands down.
Well, and Dr. Vicki has also graciously offered to introduce our licensees. Let me just kind of put up here a letter that she's provided. This is on her letterhead, you'll notice, and I'll zoom in a little bit here, but basically it's with her introducing you to the doctors that you're going to go out and speak with and market to in your area. So your name is actually mentioned in the letter, your company name, and of course she's introducing this book with this letter. So imagine having a doctor introducing you. That again adds huge credibility you would not have on your own or with any other company that I know of. So thank you, Dr. Vicki. That's a real excellent value and tool there for our licensees.
And I hope that people realize how valuable this is because, I didn't go through my own mail in my practice. My office manager went through the mail and she decided what was going to get thrown away and what was going to get presented to me. Now, she could get in trouble in two ways. She could get in trouble by screening out something that I didn't want to see, or she could also get in trouble by not by giving me junk that I didn't want to see. So if you send something through the mail, chances are pretty good that the office manager is just going to throw it away because you would not believe the volume of mail that doctors get. But no office manager is going to throw away something from a doctor. So that's why this is so very powerful.
Yeah, you can put this in an envelope and just say, please put this on the doctor's desk, and they're not going to throw it away. They can feel that it's a book. And then, of course, when the doctor gets it, we have you train you how to mark certain passages that Dr. Vicki said, look, they need to read this paragraph. And so we've gone through and marked that and shown you how to put little tabs there so the doctor doesn't have to read the whole book. We've had doctors get this book, Dr. Vicki, and they literally just flip through and read every one of those quotes, and then they call up the licensee and say, hey, I think I need to have that practice analysis you talked about because they can relate to it.
And, you know, there might be doctors who don't even read the book, but the fact that you've given them the book and the fact that your name is on the cover positions you as an expert.
Yeah. Well, Dr. Vicki, thank you so much for being on here today. I'm going to answer a few more questions and tell people about our training course that they can go through. And thanks again for taking time to be on here today.
My pleasure. I'm sure the people who are on the line are going to make a great choice. This is a great opportunity. All right.
Thank you so much. All right. Bye-bye.